Hello, my name is Nigel Lutchman from St. Mary's University,
And I'm Yves Dibeme from St. Mary's University.
and today we'll present ProTell, a way for sickle cell disease patients to manage their condition using predictive technology. Our team consists of Shivani, Yves, Emmanuel, and myself, Nigel, all from St. Mary's University. We also have a first-year medical student from Dalhousie University. So what does the face of sickle cell disease look like? Miriam is a busy mother with a 7-year-old daughter, Aisha. Both of them have sickle cell disease. At noon on a Friday, Miriam gets a call from her daughter's school saying Aisha is having severe pain. Aisha's mom rushes out in a frantic state, spends an hour in traffic in an effort to carry her daughter for treatment at the hospital. With our device, Aisha's mom receives a notification on her phone telling her of an imminent crisis before it actually occurs. The school is notified as well and takes early action, preventing the development of a crisis situation. SCP is a changing of the shape of the red blood cell from spherical to sickle shape. If these cells happen to get clogged in an artery, they deprive tissues of oxygen. This causes pain. Introducing ProTell. It's a disposable patch, but with a reusable biosensor. It is small and light. The patient forgets she's even wearing it. And ProTell uses biofeedback data to detect a crisis before it starts. So we looked at our business model canvas. Patients endure an extreme amount of physical pain. They are often alone or cannot communicate with anyone, and there's no real-time method for notifying medical staff. Our unique value proposition was the immediate notification on or before the time of a crisis. Medical staff is quicker able to treat the crisis and easier management of the crisis situation for all concerned. And what about our customer segments? Our primary segment is the sickle cell patient and the families. Secondary segments would be the NGOs and charitable foundations. So we had to make some assumptions. Our first is, if SCD is managed and monitored properly, then it can result in a better quality of life, less medical expenses, and lower probability of encounter with a painful experience. Secondly, measuring pain was the only indicator for tracking crisis occurrence. Thirdly, patients would be skeptical about wearing any technology-based tool related to STD management, and they would be reluctant to spend a fair amount of money for our solution. And lastly, our target customer would be the STD patients only. So we did some customer discovery. We conducted surveys, personal interviews over Skype. We even conducted interviews with the Sickle Cell Disease Association of Canada. We contacted the Sickle Cell Disease Association of Nova Scotia.
For our initial pivot, we wanted to go with a traditional mobile application where patients can monitor their pain and input this as a text message and send this to a doctor or anyone. What were the upside to this? It was easily customizable, it was user-friendly, and individual patients could see their pain history. The downside to this was we realized that pain was not an accurate way of predicting or monitoring the crisis. The doctors want to know more about the situation than just the pain. History were also important to the doctors than they are to the patient. For our second pivot, we intended to go with a wearable technology wristwatch. Having known that oxygen in the tissue, body temperature, pulse rate, and respiratory levels are key vitals to know, we decided to go with this technology, and the upside was we could share real-time data to devices like phones, giving room for data monitoring, storage, and better predictability. The downside was it was inconvenient for patients to wear this device at all times for two reasons. One, this might increase stigmatization in developing countries, and secondly, it will be inconvenient for sickle cell diagnosed babies. Going back to our drawing board or business model canvas, we realized that our customer segment wanted to better predict and manage this crisis with an immediate notification process. They also needed a wearable concealable solution which could monitor key psychological indicators. Our key metrics were the Sickle Cell Nova Scotia Association, the Sickle Cell Association in Toronto, and 100% of customers surveyed are willing to pay. Unfair advantage. We had a patent pending, established relationship with Sickle Cell Association, medical expertise on our team, and first mover advantage. Cost structure. The cost to produce the device and the cost for the software development. Revenue streams. One-time device fee of $500 to $1,000 per bundle, and monthly subscription as we go down the line. We also intend to make this accessible in developing countries by selling to the NGOs, who will then sell at subsidized rates to the patients. How does this device work? The users have our biosensors adhesive attached to their body. We send wireless signals to the phone. This phone then stores this data as electronic medical records and also updates it periodically to our cloud server. We send this notification to 3 different numbers identified by the patient, one of which must be a 911 emergency service. We also send this to our partners in the hospital network, and which these hospitals can update the patient data on the hospital management system. We needed to understand the stakeholders, so we determined 4 important stakeholders to reach out to our market. One were the doctors, the retail outlets, the NGOs, and the emergency units. They will help us create awareness to our patients, telling them about our product and giving them professional advice and the need for it. Also, we need to understand the flow of money. When we sell directly to the retail outlets, the patient buys directly from them. Secondly, we also sell directly to the retail outlet, the patient buys from them and gets subsidized by the insurance company. Thirdly, we sell to the NGOs, the patient gets subsidized or get it free from the NGOs. Lastly, the patient could buy directly from us. What is the size of the market? Looking at the map, the red dots denote the areas of the world that are predominantly found with sickle cell disease. We're looking at part of Africa, Latin America, the Caribbean, Middle East, part of India, and the United States. Wearable technology market is $20 billion as of present, with an expected growth of $70 billion in 2025. Healthcare wearable is about $3.4 billion, and with 3,000 sickle cell births per year, we're looking at a target market of 20% of that figure. We intend to get $24 million. Our revenue model: 60% of the people surveyed say that they're willing to pay $500, with an average cost of consumer wearables being $275, and knowing that patients don't always do what they say on a survey, we decided to go with a retail price of $400. Going for 20% of this market, which is 60,000 people adopting this device, we will make it looking at $24 million US. How do we intend to scale? We intend to scale by going to demanding jobs in the future and vet healthcare, since these pets won't be able to speak, the elderly, and also having an online presence. Thank you. We are ProTell. Be informed, be prepared.